for our health walkers, Dr. P.A. indicated, because they hold services on Saturday. They're not able to come out on Saturday and walk with us. However, there is a contingent of persons from the Seventh-day Adventist Church who will be walking on Friday. We're grateful for what they have done in the past, and we know that it is going to be even larger for us this time around. So we look forward in great anticipation for realizing that. And then on Saturday, all of us, I will be here, members of my congregation. We pray that you will be here, members of your congregations and your organizations will be engaged, that we will register at a cost of $20 per person, walk down Cascade to Abernathy to Lowry, turn left on Lowry or bound behind the West End Mall, back up Lee Street, down Abernathy, back to Cascade, and back here to the VICARS Community Center, where there will perhaps be 30 service providers who are giving us free services, free health screenings, including blood pressure, glucose, HIV testing, and many others. But Dr. Figures is back now. We want to call him up so he can share the particulars of the information that we need to know. Give him a round of applause. Let's go.
Good morning, CBC.
Good morning.
Go over some things. How's everybody this morning?
Great.
You know, there's a lot of talk about the last day for the Affordable Care Act. And I think that the President of the United States of America has staked his political career on each and every one of you sitting in these chairs, as well as the ones outside of these rooms, being able to have access to affordable health care. I found out yesterday that a lot of people were still under the assumption that that meant free. It's not affordable, but free. Because there's organizations that were signing people up on yesterday. There's organizations that are signing people up today. As the President said, as long as you go into the system, enter your information, then you have an extension. But you'll be surprised at the number of people that did not think affordable meant affordable, that affordable meant free. I heard premiums as low as $70 per month, and people thought that that was too expensive. What price do we put on our own health? What price can you put on your life? I don't think that we can. Because I think if we had to insure ourselves, I think that we would insure ourselves for the greatest amount possible, correct? But I don't think that we treat our bodies as such. I don't think that sometimes as different groups around this world, I don't think that we look at health as being important. And black men, we are some of the worst.
That's true.
We're some of the worst, unfortunately. And you ask yourself, why is that? Well, you know, there are some things that happened. That was a 40-year study that was done. You know, the study was called the bad blood study, to get those people down in Macon County, Alabama, to sign up. But the study was actually called Untreated Syphilis in the Negro Male, right? But to have people to sign up, they called the study the bad blood study. Why? Because Big Mama and them had bad blood. And they said everybody could relate to Big Mama having the sugar, right? We don't understand today what diabetes is doing to our communities, right?
All right.
And so as a result, you see more and more dialysis clinics popping up, right? You see the liquor stores, you see advanced auto, you see the pharmacies, and now I'm not talking about the Vita, but then you see the Vita popping up. And a lot of people still wondering why. We don't even understand, sometimes, not all of us, what is the reason for end-stage renal disease. Some of the things that we're going to talk about on that Friday and Saturday is how to prevent those diseases, right? Because a lot of times we know, but I feel that sometimes we don't implement the information that we're given. There's a lot of great information that is given in these rooms each and every Monday morning. But it's up to us on what we do with it, correct?
Correct.
Real quickly, yesterday I also picked up some of the information, so I have it back here on the table. I'm not a navigator. I have enough time trying to navigate my own self. So, but I have the information for you. Couple of things that I wrote down. 7 ways to nurture your physical and your spiritual life. 1, it says, be a river, not a sump, or the Dead Sea. You know why they call the Dead Sea the Dead Sea? I know most ministers do, right? Right? Nothing alive in there, right? And most of us would think of ourselves as a river, right? Is there anyone in here, you don't have to raise your hand, hopefully not, that thinks of themselves as the Dead Sea? No. We are a people, we as a people, we consider ourselves the river. Sometimes I say we just have to act like we are that raging river. Number 2 says, identify your blessings. Each and every day that we get up, and regardless of where we are, is a blessing. Correct? Correct. Each and every day that somebody says, how are you doing, is a blessing. Because whether or not that person means that genuinely, at least that person is asking, how are you today? And it's up to you to respond accordingly. If you don't tell me how you're doing, I always tell people my ESPN stopped working a long time ago. So number 3 says, speaks words of blessings. We have enough that's going on in this world today about tearing each other down, tearing each other ethnicities down. You think about it, we came together, as my great mentor, the great Alice Buster says, as a collective, right? She talks about the small businesses. It's the individual collective that gets us where we are today. That's where our power is. When you look around this room, we have people from the U.S. Attorney General. We have the sheriff of Fulton County sitting in these rooms. And then I always tell people, you'll be surprised who might be sitting next to you. Right. Number 4 says, nurture a shared prayer life. That's regardless of what your religious belief is. Number 5 says, take a step of faith. Do something for somebody else. Come out and be a part of the walk. Be a part of the concerned black clergy. And then number 6 says, we can go right down the street and we can help restore a whole lot of faith to a whole lot of people that have lost faith. And that's what these meetings are about. That's what your health is about. And number 7 says, be a grateful person. Be grateful for where you are today. That's right. And if you're not grateful for where you are today, then it's up to you to change it. It's up to you. So, and as I take my seat today, I would just encourage everyone, and I know it's a challenge weekend because it's Easter weekend, but on April 19th, we're going to fill this room with vendors and providers, and everything is free. So if we don't take advantage of it, guess who it's on? It's on us. But I hope to see each and every one of you, and if you cannot make it, please register and make that a gift to someone else. Because those services and the people that are providing those services are not asking for any other contributions other than that we have people here to take advantage of those free screenings. That's my time today.
Thank you so much, Dr. Vickers. Any questions for Dr. Vickers? Say 1.